Hi everybody, I'm Michelle.
I'm Jen.
And we're Med Peds residents. We're here to show you around the Peds hospital.
Alright, let's go. Now let us go to one of the other hubs of the Children's Hospital, our residency offices and the workroom. It's about lunchtime, so there will probably be plenty of people going to get lunch at this point. To the left are elevators, choose any floor that you want. If they're not out of order, usually they go pretty quickly. Through here are the Peds and Med Peds offices. You will get lunch here.
Say hello to all of our wonderful medical students.
So I just go hands off.
We love them. We must protect them at all costs. Here we have our chief residence workroom on the pediatric side.
Doing a little tour for recruitment. This is Matt Present. Give us a wave. Excellent.
All right. We have our lovely Peds team. Oh, hey.
Hi.
Karen Gallen.
Hi to Med Peds applicants?
Yes, you
Yes.
are.
Hi, we love you. You are Peds. What can I say?
Not a lie. Not a lie.
Karen Gallen, Program Director, CGPD.
Hey.
It says so on the door.
That's
It
right.
does say so on
Says it right there.
official
Just to prove
something.
it.
I'm dead. Literally cannot. And the two people that keep everybody going. Say hi to all of our applicants.
Hello. We look forward to meeting you all.
Betsy and Jordana. They have candy.
Yes, come get all of the candy. They will feed you and make sure that you're doing everything you're supposed to. And we couldn't do anything without them, so.
And wrap you up in a warm blanket when you're crying.
Yes. Or when you're just cold.
Or when you're just cold. Thank you for all that you do, guys.
Bye.
All right, let's go. Here is the main Peds resident workroom. As you can see, there are many computers. They all now have keyboards and mouses that are functional. This is great. A lot of people will hang out here and get stuff done, particularly in the afternoons if you just don't feel like being on the unit anymore and have a little downtime to get stuff done. So this is kind of where you'll see people. This is where you'll get sign out in the morning and sign out in the evenings. There is out of view a large whiteboard that will have all the patients for the day, split up into each of the different units, and usually people write little love notes to each other on there with nicknames and such. That makes it a little bit fun. This is the main atrium. We're gonna walk in and see some of the highlights of the Peds hospital. As we come in, to the right is some of the main conference rooms, which is where you will have noon conference. As you can see, a lot of spaces for eating lunch and socializing while learning a little bit at the same time.
Jen, what sorts of conferences are held in this room?
There are all kinds of conferences. They have different topics that are commonly tested on the boards, and so each a year and a half or so they go through a curriculum of commonly tested board topics from neurology to dermatology, endocrine, and everything in between. And every month or so there are also Med Peds conferences led by our most senior residents, the graduating fourth years, on a topic that they get to choose. And so that's always a fun way to get to mix between each side.
Very exciting. Woo! tell us about morning report.
So on Monday through Friday, you have some sort of morning conference unless you're an intern and you don't have any conference on Mondays. For the senior residents, they have senior report on Monday and Thursday mornings. Tuesday, Wednesday, Thursday, there are morning teaching on a variety of topics where you go through a case and learn a little bit about a topic that usually is chosen by the chiefs. And then Wednesdays are typically evidence-based medicine and or grand rounds led by different faculty members and people invited from other institutions.
Very exciting.
Here we are on one of the pediatric floor units. This is 7 South, which won't mean anything to you now, but will mean something to you later. But all the workrooms are pretty much the same. You have a whole bunch of computers for anybody to work from. That's where you will do your charting on all your patients, and the whole team will kind of be together in one spot so that nurses can find you if they need something from you, where you can do rounding sometimes, and where you'll be most of the time when you're not actively seeing patients. Tell us about your favorite spot, Michelle.
This is my favorite spot in the Children's Hospital. We are currently on the 8th floor in between the 8 South and the 8 North units. And what you're seeing in front of you is a lovely, beautiful view of the medical center. So across the way we see Wilmot Cancer Institute. And then out through this window here, we're seeing what's called affectionately the White Coat neighborhood, where a lot of residents, medical students, nursing students, etc., will either rent or buy houses. And it's just a lovely little quiet place to come hang out, drink your coffee, take a break for a few minutes, and then get back to work.